Welcome to Beauty Binge. We are so excited. We have a special guest with us today, Dr. Nicholas Howland, and I can't really call him that. It just didn't even sound right as that came out of my mouth, only because we have known each other since high school.
It surprises me still, too.
I know, it really does. That was like 2 lifetimes ago, it seemed. But we're really excited to be in his office, sitting down with him, and we are going to talk about an amazing topic today. All the things. Yes, all the things. All the things. All the things. Plastic surgery.
Oh.
And mommy makeovers. But the reason why, as we were searching for the right doctor to meet with and collaborate with, that we were so attracted to Nick is because of his mission. Tell us about your mission in life and why you do what you do.
Okay, so I'm a plastic surgeon here in Draper, Utah. Been in practice now since 2017. And I do feel like I have a mission as far as plastic surgery goes. And I feel like my approach is a little unique apart from other surgeons. So to tell this mission, I've got to kind of preface it with a story.
Great.
Okay. When I was in medical school, that's where I decided, okay, plastic surgery's it. Like that's what I love. That's what I want to do. And I remember finally getting into a residency program, and it's this long, grueling process, and you're interviewing, you're terrified, you're not going to get in. If you don't, it's the end of your life. And we go out to dinner shortly after I'd gotten accepted, and a friend of mine says, what are you going into? And I said, I'm going into plastic surgery. And he just goes, oh, what a shame. And I go, I'm sorry?
Really? What?
He says, oh, I just mean it's just so sad that our healthcare system has gotten the way it is, that in order to make any money, you have to go into like such a vain and horrible profession. I'm like,
that was so nice of him.
He took a lot of liberties. And I'm like, I really like it. But it was also my first introduction to, people see this field very differently.
Oh, for sure.
And not everybody views plastic surgery in the way that I'm viewing it. Okay. Because for me, like I had seen all the surgeries, and I loved the surgeries, and all I saw was helping. And it didn't matter what I was doing. Yep. And so I then get into residency, and my mom, love her, you know my mom.
I do.
And she would call me every day. And she'd be like, Picky, that's the nicknames. Picky, did you do good plastic surgery today, or was it bad plastic surgery?
Oh. Wow. Hold on. Tell us what good plastic surgery is.
So good plastic surgery is if I'm doing burn reconstructions, if I'm doing big wounds, if I'm doing cleft lips and palates, I'm somehow her son who's saving the world.
Got it.
Doing good plastic surgery.
And bad?
If I'm doing nose jobs, breast augmentations, liposuction, that's somehow the bad plastic surgery.
Okay, now the viewers know good versus bad. Okay.
And it was, again, this just like message to me of, okay, there is some disconnect, and there's a divide here. I mean, even the American Society of Plastic Surgeons will have meetings where they separate aesthetic plastic surgery from reconstructive plastic surgery. And there needs to be that separation in terms of like what the two fields are doing. But that has also created this kind of line even in our society where we're like, okay, if you're going to have plastic surgery for these reasons, that's okay. But if you're going into for these reasons, that's somehow vanity and not okay.
Yeah.
For me, I have never seen that. And I sat on a podcast or an interview just like this with a woman who asked me this. I said, I don't think plastic surgery has anything to do with vanity. And she laughed at me. And
in disagreement.
100%.
Yeah.
And I can see people doing that and that reaction. But here, let me explain. I have seen a straight up breast augmentation change a woman's life just as strongly as a cleft lip changed a kid's life in Guatemala. and I've been present for both of the surgeries and seen the follow-up on both of those patients. Because when somebody, and this particular woman I'm thinking of, had 3 kids, had 0 breast tissue, pushing these kids around in a stroller, and was asked if she was the nanny or the babysitter, and she's this strong, independent, feminist, prominent figure, and she's like, I did not feel like a woman. And I wanted breast implants so that I could feel like a woman.
1000%.
I was comfortable with me. I loved me. I had no problems with my own self-image. I just didn't feel like a woman. And breast implants changed her life.
Absolutely. Yeah.
And so that's not vanity.
Agreed.
So anyway, that's my mission.
I love it.
We get that a lot. Cosmetologist, esthetician, you're in the vein field as well. Right? Like if you want lashes, if you want your brows done, anything.
Right. Hair makeup on, hair extensions, all of that.
It's all
right. Any kind of fillers, any kind of lip fillers. Absolutely. You're considered main to some. To some.
So my mission is to remove the shame associated with plastic surgery.
Yeah. And I love that.
That goes along with the first question, right?
Yeah.
That we had written up. We live in the state of Utah, which it's very taboo around here to talk about it, to admit you've had it done.
Right.
To want it. It goes along with that, like your name.
Which is wild because the culture here and the numbers, this has constantly been one of the top places for plastic surgery in the country.
Now, why is that?
Right.
Why is Utah like not one of the top states?
So I've actually given this lecture a few times.
Oh, you have? Okay, I want to hear it.
No.
And this is like fact-based.
This is both. This is fact-based, and it's also what I've seen in my own data. Because I don't think there's one specific answer.
Okay.
I think there are a lot of answers. Utah is an extremely wealthy place. And money is always going to be associated with plastic surgery. It's a luxury item. And so wealth equals plastic surgery. Miami, Beverly Hills, Salt Lake is up there. The other thing is the way that the predominant religion here drives the culture is a part of it.
Yeah.
And that's not a knock on Mormonism or the church.
Right.
One of the big reasons I think it's so prominent is think about the other things that are prominent here in Utah. MLMs are bigger here than anywhere.
Yeah.
The reason being is if you go to an MLM company, you're like, I'm gonna sell Zango juice. Sorry, that's the last MLM.
Is that around? Come on.
Whatever.
Yeah, okay. Zango, I like it.
Zango juice. If you live in Texas or Missouri or any of these other states where you don't have this LDS culture, you're just knocking on doors, calling friends or whatever.
Right.
If I live here, I go to church on Sunday. There's 400 people in my ward that know me, that are close to me, that I can say, hey, I'm doing this thing. Support me. Oh, sure. And I go to my stake. There's 4,000 or 5,000 people in my stake. Oh, we know this guy. He's doing this. We'll support him. It's this completely built-in network that you have here.
Yep.
And so plastics and that type of a network also, unfortunately, creates keeping up with the Joneses mentality.
That's what I was going to say.
And so when I was I like stories. You guys are going to have to put up with stories.
That's where I love stories. Oh, right.
So when I was young and very first got married, my ex-wife and I moved into my sister's house, and we went to we were both LDS. We went to their ward, and they got a new Nissan Armada. It was like when the Nissan Armada first got released, it was like the cooler suburban, like cooler than the suburban soccer mom car. 2 weeks later, there's another family that shows up with a brand new Nissan Armada, but a little better. Tinted windows, wheels on it.
Of course.
2 weeks later, another family shows up, full decked out package, like TVs in the headrests. They win, right? It's the best Armada. Well, about a month or two later, the wealthiest family in the ward shows up, and they've got the Infinity version of the Nissan Armada. It's just like this one-up mentality. And plastic surgery, I think, thrives in a keeping up with the Joneses mentality, where if Sally gets her breasts done and Molly and Becky and Susie are feeling like, oh my gosh, I want to look that way too.
Right.
So that's a part of it. The theology itself is a huge part of it. Mormonism is a perfectionist theology. The whole purpose behind it is to be like God. And that just, like, whether that's taught to you from the pulpit or not, that triggers oh my gosh, I need to be the very best version of me I can. And then there's all sorts of other reasons. We have not only some of the highest birth rates in the country, but the highest birth rates in teens and early 20-year-olds, and the highest now I'm forgetting the word, but multiple pregnancies of people in their 20s in the country, and it's not even close. And so you've got people who by their late 20s, early 30s have had 3, 4, 5 kids.
Right. And so they want to get
bodies destroyed.
Absolutely.
And so all of those reasons contribute to Utah just being a huge hotbed for plastic surgery.
So how many like out of state people come in and like contribute to those numbers? Do you see a lot of like
a huge amount?
Okay.
I think it's starting to change a little bit. There's again a few reasons for that. We live in an area where we're surrounded by 4 states that don't have a significant population to provide for plastic surgery. So a lot of Idaho, Wyoming, Colorado people come in. And then for years, plastic surgery in Utah, for whatever reason, has been very, very affordable compared to other states.
Yeah.
And so people would come in all the time and still do, from California and East Coast, where plastic surgery is the same procedures costing them 2 and 3 times what they'll pay to come here. That started to change. Prices here have started to go up significantly as part of the economy, as well as more plastic surgeons moving in, and changes in marketing and all of that. But I still see a lot of out-of-town people.
Can you give us like an average cost of a standard
mommy makeover?
Yeah.
Well, just let's
rest.
Yeah. What is that? It's just like a typical implant.
I will tell you what I started at and where it's gone in just 7 years. So when I came out, most people were charging right around $5,000 for straight up augmentation.
That's what mine costs.
Yeah.
Have the receipt. Okay. That was 7 years ago. I'm a few years out. So what's it going to cost me?
All right. And I came in and was like, oh, I'm going to undercut everybody. And so I had this special where we put up a billboard. I'm going to do them for $4,500. And that was a good little kickstart to my practice.
Yeah.
Now, there are some people who are doing it for cheap, but most people who are board certified plastic surgeons are doing it for around $8,000.
Wow.
Okay.
And that's
board certified?
Yes.
Oh, good for you. That's great.
Yes.
Okay.
Okay.
And we'll get to the board certified discussion because that's a whole other.
Yeah.
Oh, yeah, I know. My former partner was board certified. I know all the things. So I know the route you have to take to get board certified. You only want to see someone that's board certified, though.
You do.
If I'm telling you this now, viewers, when you go to find someone, we'll come to Nick, of course.
And
they need to be board certified.
That's important because, correct me if I'm wrong, can any like surgical doctor do what you do?
Oh yeah.
But they might not know what they're doing.
Yes.
Right.
And
of course,
our biggest competition as plastic surgeons is actually other doctors who are not plastic surgeons performing plastic surgery.
Right. That
Which is
often.
scary. I think that's scary.
It's super scary.
Yeah.
And they've tried to and made a little bit of progress in changing the laws. But it's still hard. If you don't know what to look for, it can be hard. And so somebody can advertise themselves as a cosmetic surgeon. They can say that they're board certified. They might be board certified in radiology or family medicine. And they went and took a weekend course in breast augmentation, and they can now call themselves board certified cosmetic surgeon.
Oh my gosh, I didn't know that.
And if you don't know you've got some of these websites too, and their marketing is fabulous. And so unless you like drill down, and what I'll tell patients to do is go to their website, click on about the doctor, and just read about their training. because they'll tell you where they went to school, what their residency was in. The easiest way, though, is to find out is just no doctor who's, if you're not board certified, you can't display the American Board of Plastic Surgeons logo in your office. And so if somebody has that logo, they're a board certified surgeon. And you can also just say, hey, are you a board certified plastic surgeon?
Yeah. So what questions specifically should people be asking if they're going in to have,
a few things. Are you a board certified plastic surgeon?
Okay.
And you want to specify that because people will tell you, I'm a board certified cosmetic surgeon. One of the biggest providers of...
So you need to say plastic.
Mm-hmm.
Okay.
One of the biggest providers of plastic surgery in Utah is an oral surgeon.
Oh, gosh.
And that's not a knock on him. It's just, he has brilliant marketing.
Just to clarify, oral surgeons work on your face.
Oh.
Yeah.
Yeah. Just so you know, that's what an oral in your jaw, not your boobs
Or anything plastic surgery.
or anything.
Okay.
Number two is you want to know whether they have hospital privileges or not. Because a lot of plastic surgeons will operate at their surgery center like we do here at mine, or out of their office. And if something goes wrong, you want somebody who has privileges at a hospital.
Okay.
And that will, number one, you're going to be safe. And number two, hospitals won't give privileges to those people who are doing plastic surgery and aren't plastic surgeons.
Oh, great.
And so you're kind of even bypassing that first question by just saying, do you have hospital privileges and where?
Oh, perfect.
Like I couldn't have hospital privileges at, say, IMC and do brain surgery. They're going to say, no, you don't have the training for that.
Right.
Sure.
And those are the two biggest ones to ask. And then number three is just say, show me your before and afters.
Okay.
Like have them show you their work. If somebody doesn't have before and afters or doesn't show you their work, it's just a red flag.
Yeah.
Good to know.
Okay.
Those are my top three.
Yeah. Okay.
Okay. I want to know, what's your favorite service to provide?
Oh, okay.
Or surgery.
Oh,
I
okay.
don't know what you would call it.
Yeah.
So this question comes up a lot and I get raised eyebrows when I answer this question.
No, you won't get that. I'm
Because one of my favorite procedures to do is a labiaplasty.
What?
Which
The what?
labiaplasty
Really?
is
Down.
fixing
Are you
extra
serious?
vaginal tissue.
Well, now I've
100%.
got to know about
I'm shocked. Okay.
another episode when John.
Okay. Tell us why.
It's a quick operation. It's
Okay.
takes me 45 minutes.
Okay.
It makes an immediate difference. And the success rate is extremely high.
Okay.
And what the biggest complaint, I'll get two complaints with this. Number one is it hurts during sex. Because if you have extra tissue that's getting pushed.
So that's why
places
they
around,
count in.
Interesting.
That's the number one reason to bring them in.
Okay.
The number two reason is I don't like the way it looks in my yoga pants.
Oh.
This is
Hey.
This is 100% true.
No, this is good to
If you-
talk about.
If you look at the rise in popularity
I'd
of
like
yoga
to
pants,
see a picture because it.
the rise in popularity of labiaplasty has gone up at the exact same
Heard of
rate.
it. I didn't know it was.
So there's
Very
just
popular.
too much.
It's just
skin.
too much tissue, and sometimes it's
Okay.
just natural. This is genetic. A lot of times it happens with pregnancy and childbirth.
Okay.
Yeah.
Okay.
And so it's a simple operation. The pain is very minimal, and again, immediate results.
Really?
And that's why I like it. I like it because it provides a good result that people appreciate.
Yeah.
Is that like your most popular service, would you say?
No.
Or what is your most popular?
So my practice is pretty head to toe. I do what I would say that I'm known for here in Utah is I do a lot of body contouring after weight loss. And
Oh, interesting.
was kind of like not stumbled into, but you kind of find your niche as you start your practice.
So is that like getting rid of loose skin? Right?
So
Okay.
when I was in training, I trained in Houston. My mentor, Linda Phillips, that's all she did. And she's probably the top 2 or 3 surgeons in the world of body contouring
Wow.
after weight loss. And Houston, I mean, you're dealing with, it's one of the most obese cities in the country.
Oh, yeah.
And you're dealing with people who've had, that's where My 600-Pound Life is filmed. So I worked at that hospital a lot.
Oh, wow.
And so you're working with people who've literally lost 300 pounds and still weigh 300 pounds. And that was my everyday. And so we're doing these big cases where we're cutting off, 20, 30 pounds of skin. And when I came here, I thought, oh, if I never have to do one of those cases again, because that's all you do.
Yeah.
And the first few patients that I saw that came to me who had a bariatric procedure here, they'd lost 100+ pounds. And I said, yeah, we can do this, this, and this. I had a few patients start crying in my office. And so what's wrong? And they said, we've been to 6 plastic surgeons and none of them can do this. And I go, oh, you're a chip shot. We did it every day.
You're like, only 100 pounds? You're like child's play.
So it just became a very big part of my practice. And I love it. And it's a very rewarding part of my practice because a lot of these women and men have worked their ass off. So butt, ass, I don't know.
Yeah.
Literally.
Yeah.
And they then have all of this extra skin, and it's a constant reminder of who they were.
Yeah.
And so being able to cut it off is like one of my most favorite procedures to do.
I love that.
Can't
beautiful.
Work skin off. I mean, I had twins, so like I fell into that category and had the mommy makeover, and it was amazing because like I would get into
What exactly did you have done?
So breasts and tummy.
Okay.
So that all got ruined, right? With kids.
Of course. Yeah.
So I would get into a plank and my skin would just hang.
Exactly.
And there's nothing you can do to fix that. And like it was uncomfortable in my pants. So
I tell patients you can tone muscle all day. You cannot tone skin.
Yeah.
And so sometimes we just you trade skin for scar, but it makes a huge difference.
it really does.
Yeah.
One of my biggest realizations in just the last year and a half. Like that's what's great too about I love what I do because I'm constantly learning from my patients. This girl came in and we had done 2 rounds of skin removal for her, and her story, she shared her story on my podcast, is incredible. She she got married very young, and her husband was very insecure, and he would give her a hard time when other guys were looking at her, and he would accuse her of flirting with these guys. And so she developed this idea of, well, if I just put on a bunch of weight, guys will stop looking at me. So she puts on 100+ pounds. The relationship continues to kind of devolve, and she finally decides I've got to leave. It's not healthy. So she puts 2 boys in the car, goes in to tell the husband that she's leaving, and he shoots himself in front of her.
You're kidding me.
And she came on my podcast, and I had no idea that this story was coming. I just knew that we had done her surgery and that she was happy. And so I didn't know the story. And she then tells me all of the work that she put in after that. She starts exercising. She starts going to therapy. She's got her kids in therapy. And she put in years of work, lost over 100 pounds, diet and exercise only too for her. And that's not a knock on bariatrics. Sometimes bariatrics is absolutely needed, but for her, it was all diet and exercise. And we did her skin removal surgeries. And at her last visit, I come in and she's just sobbing. And I'm like, oh my gosh, what's wrong?
Yeah.
We're like, oh no. Oh no.
Yeah.
And she says, no, these are tears of joy. She's like, I need you to understand. I finally see on the outside how I feel on the inside. And for me, it's like, oh my, like every part of what I do and my mission was confirmed in that moment. And I realized plastic surgery doesn't change anybody.
Right.
Only you change you.
Yeah.
Right.
And it starts inside out, and it can help.
1000%.
It can help you see the changes that you've made.
Yeah.
Right.
but that's really about it. And that's why for me, it has nothing to do with vanity.
Yeah.
Right.
Anyway.
Yeah, that's such a beautiful and I think powerful story. And at Beauty Binge here on our YouTube channel, and even with our company, Bella Marquet, that we have, we're all about empowering females to feel powerful. And when that comes to your external appearance, doing whatever that looks like to you.
Yeah.
Right? So Tiffany and I both have had plastic surgery, and it's changed both of our lives. Like, funny story of mine, yeah, I had 3 kids, and my breasts were little,
What do you
udders.
call that? Wait,
They were udders. They were like saggy udders.
Yeah.
And I remember I decided I needed to do something when I was actually hanging upside down at the gym with my trainer.
I love this.
In roots. I'm literally hanging upside down doing crunches, and my boob fell out. It just like sat down. It was like dangling.
I had that on.
My trainer was like, Heather, I didn't even know.
Put that away.
That's not allowed in here. Best friends and such close friends. So I'm just like looking at it, and I just like tuck it back because
You feel like your body's deformed.
it is.
It's
And
so deformed after.
yeah, and it's just that lack of confidence. And ladies, I know we all feel kind of that lack of confidence at times. And so when I got a lift and implants, it completely helped.
Yeah.
Right?
Well, and here's the thing too, the opposite is also true. Like if you are somebody who this doesn't bother me,
Absolutely.
yay.
Yeah.
1,000%.
For you, it bothered you. It had nothing to do with your self-image and how your self-love and how you felt as a person.
Right.
Just something you wanted fixed. And
100%.
Yeah, absolutely. Yeah.
and I continue to, so I try to promote this as much as I can. And it's funny because I will get so much hate when I push this, there's no shame in plastic surgery.
Yeah.
So Megyn Kelly on Fox, whatever. I don't care. I don't have a thing about Megyn Kelly, but I posted this story because she had given what is the actress's name? She plays in the movie or the TV show The Boys. And she had given Erin Moriarty. So Erin Moriarty put up some picture that looked like she had plastic surgery.
Yeah.
And Megyn Kelly comes on and just rips her apart for having plastic surgery. How dare you, give kids who look up to you this idea that you have to have plastic surgery. And Erin Moriarty came out with this statement of like, those comments really, really hurt me. I've actually never had plastic surgery, and this is just who I am. And so I put up this post like, we got to stop shaming people.
Yeah,
there's zero shame in plastic surgery.
Absolutely.
And the comments, oh, shocker that the guy who makes his living doing plastic surgery says there's no shame.
Yeah.
So I turn around and there's another article, this one about Sarah Jessica Parker.
Yeah, so I had any
She's getting shamed for not having plastic surgery.
Huge.
Yeah.
And so
That was huge.
as a society, like, we can't pick and choose.
No,
It just,
if you do, you're down. If you don't.
No.
there's no shame.
Yeah.
No.
Do what you want. But
Yes.
I will tell you, it can be one of the most self-empowering things you can do for yourself.
Absolutely.
And it can be self-empowering to not have it done.
Right. And I think that's where, like, I'm a huge promoter in just loving and accepting everyone for who they are and how they are, no matter what.
Mhm.
One of my best friends went and got a nose job. And of course, my initial reaction was, why would you do that? You're stunning, right?
Yeah.
And then you have to take that step back and be like, hey, if this is going to help you feel more confident, more beautiful, 1,000% I support you.
Yeah.
I see that every day.
Just taking that step back
Yes.
and supporting.
I see it every day because people will sit in my office and they oftentimes are there with their husband or their significant other, and God bless them, they're saying the things that they think their partner needs to hear. Is they'll tell them, oh, you don't need anything, baby, you look great the way you are. And sometimes I'd be like, that's great. We appreciate that.
Yeah.
This isn't about you.
Yeah. Well, for sure.
This is about this person.
For sure.
And that doesn't take away how they feel or the love for them or anything at all. But it is, those decisions are only about that individual.
Yeah. Yeah. I remember my cute former partner, he's like, well, I just need a handful. And I was like, with your hands, huge. I was like, wow, okay. Like,
It's too much.
watermelons.
It's too much.
So had I had listened, it would be a whole nother look for me right now. So I did what I said. It made me feel confident.
I have said that to so many patients, and now I need to take that.
So ladies, listen to yourself though, and do what will make you feel confident, not another person, right?
100%.
They're going to love it regardless. Let's get real.
It's about you.
Yeah.
It's about you.
Yeah, but I love the stories you've told. I think that really helps, like, with the taboo-ness of it all.
I hope so. I have done this from the start. I've done it my way. Sometimes it's been for the better, sometimes for the worse. I put up a billboard a year into practice here that got me in some trouble. It was a picture of the LDS temple, Salt Lake Temple, under scaffolding. And it's
no.
we probably shouldn't have put this up in Provo to start.
Yeah.
Oh, Nick, baby Salt
But it said, God's remodeling his temple. Isn't it time to remodel yours?
Wait,
100%.
how did this work out for you?
So we had it up for a week.
Did you get a lot of calls?
We had it up for a week. I knew it was going to get some religious blowback because
of course,
any picture of the temple, any tongue-in-cheek joke is going to get some blowback. What happened, though, that I didn't expect is this girl got on Twitter and did a video of it and accused me of body shaming women. And that's when it went completely south, and people started one-star reviewing me, and KSL came and did a news article on it, and we pulled it down because my practice was new. I was getting all these one-star reviews on. And the sad thing is, she missed the whole point. It's really bad to tell somebody, you should probably get plastic surgery. It's just as bad. It's just as toxic to say, hey, you know what? Your body's a temple. You shouldn't do anything about it. You can't do anything about it because it's a temple. That's just as bad. And so that was the whole point I was making with the billboard, and it completely got missed. A friend of mine, the night before we took it down, she begged me. She's like, don't take it down. Go on that news show and tell them, you know what? There's no shame in plastic surgery. That's what this whole billboard is about, and I'm not going to budge. And I regret that decision to this day, taking it down. I should have followed her advice. I should have left it up. I should have said, no, this is my mission. There's no shame in plastic surgery. You're missing the point. I didn't do it.
Well, you just did.
There you go.
There you go. Amen.
Thank you. Well said.
Very good. Well, this has been so fun.
Thank you for having us.
Of course.
I know. Thank you so much for inviting us into your space, and
thank you guys. I love what you're doing. And keep doing it.
Yeah. Oh, we will.
Good.
You too. Okay.
Thanks for watching, you guys. And if you have any questions about plastic surgery, opinions, we'd love to hear it in the comments below.
And be sure to give Nick a follow. We'll put his social handles all down below and all the ways you can get in touch with him and his company.
Thank you.
Yep.
Thanks, guys.
Thank you.